Go ahead. Okay. I will be talking about physician-assisted suicide in my persuasion speech. So I just want to ask you guys a few questions. Physician-assisted suicide is currently not legal in the state of Nebraska, but if a patient has a terminally ill diagnosis and they are given less than 6 months to live in Oregon and I think it's Utah, they can choose physician-assisted suicides. So, Teresa, have you ever heard of physician-assisted suicide?
Yes, I have. Do I agree with it? No.
Why is that?
Because it's not our choice to decide those things.
Okay. Chris, have you known anybody that would benefit from physician-assisted suicide? And why would they benefit?
I think terminally ill people would. I think it's similar to hospice, if you think about it. Roxanol, if you give enough, it decreases the respiration. Sooner or later, they just peacefully exit. It's you're now thinking, well, are we going to treat their pain, or are we going to watch them suffer for a long period of time, or are we going to treat that pain? If we treat the pain, you're giving Roxanol, you're giving a lot of different other medications, Ativan, which will decrease the respirations. Good possibility of them expiring while you're giving that. I agree with it. I don't think anyone should have to suffer, especially when they're crying and screaming and hollering, please help me, God, please help me, do something, I can't take it. Yeah, I'm for it.
Very good. What would you suggest instead of doing physician-assisted suicide?
Hospice.
And Sally, would you feel different if a loved one or you yourself had a terminally ill diagnosis?
I agree with the physician's assisted suicide, but until I'm in that position, I don't know, my thoughts and opinions might change.
Okay.
But as of right now, I would be for it.
Okay. Do you think medicine advancement will give terminally ill a better life?
Good.
And Erin, do you think physician-assisted suicide is ethical? Why or why not?
There's two sides to that. I think it's ethical because I don't feel that they should live in pain, but at the same time, no, it is not our right to choose when you do or don't go.
What stipulations do you think would need to be put into place before we legalized physician-assisted suicide?
There would have to be a lot of tests done. You would have to know that there is actually no other way of prolonging a happy life. You don't want to just say, oh, well, they have cancer, so let's go ahead and do it. You know, if they're going to have 20 good years, it's not an option. But if it is, they have no more choices, they've got 3 to 6 months, I think it should be their choice.
Very good. Thank you very much.